Today, I will be presenting a community intervention plan focused on addressing food insecurity and mental health in Chester, Pennsylvania. Food insecurity is more than simply not having enough food. It's a significant social detriment of health that affects physical health, mental well being, and quality of life. In Chester, many residents experience poverty, limited transportation, and reduced access to healthy food options, all of which contribute to poorer health outcomes. This intervention proposes a community based approach that combines food assistance, mental health support, education, and partnerships to improve health equity within the community. Chester experiences disproportionately high rates of poverty, unemployment, chronic disease, and food insecurity compared to many surrounding communities. Residents often live in neighborhoods with limited access to full service grocery stores while facing financial barriers that make purchasing healthy foods difficult. These conditions increase the risk for diabetes, hypertension, cardiovascular disease, depression, and anxiety. Food insecurity also creates chronic stress, forcing families to make impossible choices between paying for housing, medications, utilities, or food. The intervention seeks to address these interconnected challenges by strengthening community resources rather than focusing solely on individual behavior. Why this matters. Research consistently demonstrates that food insecurity and mental health are closely connected. When individuals experience uncertainty about where their next meal will come from, stress levels increase significantly. Chronic stress can contribute to anxiety, depression, emotional eating, poor diabetes management, and worsening physical health. Over time, these issues reinforce one another and create a cycle that becomes increasingly difficult to break. Addressing food insecurity, therefore, has benefits that extend beyond nutrition. It also supports mental health, chronic disease management, and overall quality of life. The intervention is guided by the social ecological model. This framework recognizes that health is influenced by multiple levels, including individuals, families, organizations, communities, and public policy. Rather than assuming food insecurity results solely from personal choices, this model highlights how transportation, neighborhood resources, healthcare access, and public assistance programs all shape health outcomes. Because food insecurity is influenced by multiple systems, effective interventions must also occur across multiple levels. This is why the project combines direct services with partnerships and community engagement. As you can see, there are multiple levels here in the pictorial that I provided. Our proposed intervention is the Chester East Side Community Resource Navigation Program. Residents first enter the program through outreach, events, or referrals. They receive screening for food insecurity and mental health concerns, such as the PHQ-9 or the GAD-7, and some other screeners if necessary or deemed appropriate. Based on those results, individuals are connected with immediate food assistance, SNAP enrollment support, nutrition education, and referrals to mental health providers when appropriate. Educational workshops focus on healthy eating, diabetes prevention, financial wellness, and cooking with affordable foods. The program also emphasizes ongoing follow up to ensure residents remain connected with services rather than receiving one time assistance. Ultimately, the goal is to build long term stability rather than simply responding to immediate crises. And here's just a pictorial of the map. We start with resident engagement. We screen and assess. We offer immediate support. What does that individual need in that moment? Do they need food pantry access now? Do they need help with enrolling in SNAP? Then we, connect them to care. If, their mental health assessment or screening showed that they're suffering from moderate to mild to moderate depression or anxiety, we might refer them out, which is obviously challenging now because of the closure. But that's also where we would step in to provide resources on other crisis locations and or mental health locations for those individuals needing that additional support. Step 5 would be education empowerment. So this would be where we educate nutritionally, focus on diabetes prevention education or perhaps diabetes management education, cooking classes, financial literacy classes, and perhaps even a mental health group. Follow-up and ongoing support would include ongoing check-ins, continued resource navigation, peer support, and with the hope of long-term well-being. Here's the community resource map. This map illustrates the concentration of community resources throughout Chester. Food pantries, meal sites, healthcare organizations, transportation routes, and mental health providers are displayed alongside the designated low-income, low-access census tracts provided by the USDA. Although resources exist throughout the community, geographic access, transportation barriers, and financial limitations continue to prevent many residents from utilizing these services. The purpose of the intervention is to improve awareness, coordination, and accessibility of these existing resources rather than creating entirely new programs. Okay, here's the logic model. The logic model demonstrates how our intervention translates community resources into measurable outcomes. Inputs include Chester Eastside staff, volunteers, partner organizations, food donations, funding, and healthcare providers. These resources support activities such as food distribution, screenings, referrals, nutrition education, diabetes education and management, and outreach. These activities produce measurable outputs, including residents served, screenings completed, referrals made, and educational workshops delivered. In the short term, we expect increased awareness of community resources and improved access to food. Midterm outcomes include reduced food insecurity, greater healthcare utilization, and improved mental health. Long-term outcomes include improved chronic disease management, higher quality of life, and a stronger community resilience. The evaluation plan. Program successes will be evaluated using both process and outcome measures. Short-term measures include attendance, pantry utilization, referrals completed, and workshop participation. Midterm outcomes include improvements in food security scores, increased SNAP enrollment, and reductions in depression and anxiety symptoms measured through screening tools such as the PHQ-9 and the GAD-7. Long-term evaluation will examine reductions in emergency department utilization, improvements in chronic disease management, and overall community health outcomes. Continuous evaluation will allow the program to adapt based on community feedback and ever-changing needs. And here's some community partnerships. No single organization can solve food insecurity alone. Strong partnerships among Chester Eastside Inc. include food pantries, healthcare providers, schools, faith-based organizations, universities, and local government are essential. These partnerships improve communication, reduce duplication of services, increase referrals, and strengthen community trust. Working collaboratively allows organizations to maximize available resources while providing more comprehensive support to residents. Some key takeaways: food insecurity is a significant, complex public health issue that affects both physical and mental health. Nutrition education can improve knowledge, self-efficacy, and resource awareness among pantry participants. Chester Eastside is well positioned to integrate health promotion into existing pantry services. Community partnerships can support a sustainable, low-cost intervention. This project demonstrates how social work can address health equities through community-based practice. Thank you.